Guys, phone consultation. Okay? Phone consultation. In your Lab 2 exam, you have 6 stations phone consultation. Or if you have video consultation, it's the same approach. So how many stations do we have? 6 out of 16. What is the percentage of phone consultation stations? Okay, it's 1/3. 1/3 of the exam. So if you are able to pass, the phone consultations, it's 1/3 of the exam. You need 4 more stations from the rest of the exam. Okay? Why? I will tell you some principles, but I don't like to talk too much about, we like to just, get the point, yeah? Phone consultations, they started doing phone consultations in the exam because of COVID. Not because of the contact between you and the simulator, no. Because nowadays, we have something called phone consultation. Before you go to the GP, ring, yeah? And sometimes you don't even need to come to the GP. Okay. Any station that used to come as a face-to-face consultation, it can come as phone. So, are there any specific stations, Dr. Ahab, how are you? I've asked about you today, by the way. Are there any specific stations where it's just phone? No. I can bring tiredness, phone. I can bring a patient who wants the emergency pill, phone. I can bring any station over the phone. But one principle, or some principles in the phone consultations that you should know. And please, it's not for you to memorize. It's not for you to, no. It's for you to understand and apply. So if, after today's session, if we don't try to speak to our friends over the phone, and I mean it, no video. Do the 8 minutes over the phone. If you are in this room and she's in the other room, yeah? Okay. The principles of phone consultations. The first principle of a phone consultation the first principle of a phone consultation is understanding the question. What do you mean by understanding the question? Reading the question properly to know who is calling. So this is the first principle, is understanding the question. The first principle in a phone consultation is understanding the question. Who's calling? Is it me calling the patient? Or is the patient calling me? So basically the 1.5 minutes in front of the cubicle, before you enter the cubicle, wallahi, my only concern is understanding. What do you mean by understanding? If the question said the patient called you, then you are having the phone and you tell him, okay, he's calling the patient. You should tell him, how can I help you? But if the question said the patient, you are calling the patient, and then you are ringing and saying, how can I help you? Is it right? You are calling. No. Understanding the question is, am I calling to talk about your dad or your mom? Or am I calling to talk about your daughter? Or am I speaking to you or the patient? You understand? For example, dementia station. You are ringing the son to speak about his mom. You are not ringing the son to speak about him. So his mom is at home. She's not in the hospital. So many doctors, they say, Hi, am I talking to Andrew? Can you confirm your full name and date of birth? Why do you want Andrew's date of birth? You need his mom full name and date of birth. He only needs Andrew's name. Andrew's mom is at home. And you tell him, well, since your mom has been admitted in the hospital, we noticed his mom is at home with him. Imagine if the doctor is calling you and talking with you and thinking that your mom is in the hospital and your mom is with you at home. You understand me? Will you trust him? He doesn't know anything. Sorry? Yes? No, I'm not gonna hang over. I'm gonna ask him cognition questions. I'm gonna ask the doctor, doctor, do you know who you are? Do you know who I am? Can you confirm your full name? I will ask the doctor cognition questions because he knows nothing. And that's what will ruin your start. Your start will be ruined in a phone consultation if you don't know the setting. Who I'm talking to, about who I am, where you are you at home? Am I talking about your mom who's in a care home or at home or in the hospital? Who's calling? Is it me or you? You understand? Plenty of times I've said it. And tomorrow in the mock, the phone consultation will be here. 2 stations. Be careful. I want you to understand the question. Okay? You have been asked to call Mrs. Ali because her husband has been diagnosed. CT scan was done with subarachnoid hemorrhage. Okay? Then you've been asked to deliver the news. You're ringing her. She's at home and Mr. Ali where? In the hospital. You ring her, how can I help you? Brother, you are calling to inform her. It's not how can I help you station. It's I am Dr. Fath Al-Bab, one of the junior doctors here. Can you confirm your full name? Can you confirm your husband's full name and date of birth? Your husband with us in the hospital now. You see this kind of, he's here now. I'm ringing you to update you about his condition. You understand? This is the start. Not how can I help you. And then she tells you, doctor, you are calling me. What do you mean? And then you start shaking. The session is finished from the start. So what is the first important point in a phone consultation? I'm not going to tell you medicine. Don't expect that medicine, phone, medicine. No. Understand the question. Because this is the main concern and that's what you all do in the mock, and tomorrow you have mock and you will see. If you have mocks, you will see. What is the second point? What is the second point in a phone consultation? Sorry?
The number and the address.
Okay?
It's a good time.
The first step, I said, understand the question when you're outside.
Yes, sir.
Yeah, now I'm getting in. What is the first thing I will do when I grab the phone?
Talking to.
Is this the best?
I know the question, who's calling, then I will start confirming identity before anything. When I confirm identity, what is different from confirming identity face to face? Over the phone, if I am talking to you about your dad, so can you please confirm your full name and then your father's full name and date of birth? Okay, that's the way. So I confirmed identity for his name and his date of birth. Then there is the first line of the address, which I will tell you. Is he living at such and such? So I'm telling you. So there is a full name, there is a date of birth, there is address. Don't worry. You don't need to say to her, can you confirm the address? No. The rules of a phone consultation, that you need to confirm 2 things only. By that, confirm full name and date of birth, and you are allowed to say, are you living at? Is your dad living at? And you can tell her the address. You understand me? You can, because confirming identity is 2 things. Pick two. So I pick the full name and date of birth, and I tell them. So are you living at, or is your dad living at 303 Prescott Road? Yes. That's confirming identity. But when I confirm identity, please make sure before you ask her about the identity, tell them who you are. Some doctors, they say, hi, can you please confirm your full name? And then, can you please confirm your dad's full name and date of birth? And then they say, I'm Dr. Fatih Al-Bab, one of the general doctors in the hospital. Dr. Ahab, if I call you, if you receive a call and someone says, can you please confirm your full name? Seriously, who are you? Can you please confirm your father's full name and date of birth and bank card details? Who are you? Understand? Seriously, who are you? So please, when you confirm identity, what to do? Tell your identity first, who you are, introduce yourself first, then after that, can you please confirm your full name? And if you are talking about her father, can you confirm his full name and date of birth? She will confirm. So you can tell her, are you living at 303 Prescott Road? You understand me? So you are allowed to tell the address. Because you only need how many identity? Two. So you are allowed to say the third one. It's fine. So you will confirm her full name, the father's full name, the father's date of birth. Then you can say, are you living at such and such? Okay. So I confirmed identity. Please, I always reflect on the mistakes. When I'm giving a lecture, I reflect on the mistakes because it's the majority of us make these mistakes. So please do not ask about the identity before what? Introducing yourself. Look, even in the hospital face to face, you shouldn't. But I would say it will not be as bad as if you are over the phone. Because over the phone, he doesn't know. He doesn't know. So you are not allowed. Like back home in Egypt. The police sometimes, undercover police, you don't know that they are police. They stop you. Can you show me your identity? Should you show him your identity? You should. You should. I went. There you go, brother. You know, my identity, my passport in Egypt. Because, you know. So, okay? Yeah, in UK, no. It's okay if who you are. Can you please tell me who you are? But in Egypt, yeah, the police is okay? So after confirming the identity, now step 3. The third point. If I am calling, the doctor is calling you, is it okay to talk? Is it the best time to talk? But if you are calling me, if the patient is calling the doctor, the question said you have been asked to speak to, Mrs. Julia Roberts. You've been asked to speak, obviously it's right time for her. Does that make sense? So you shouldn't ask, is it the right time for you? Because she's ringing you. But if you are ringing her, if you are ringing the patient, yes, you will ask, is it the right time to speak? Guys, is it making sense what we're saying? So please, before you start the consultation, if you are calling, ask, is it the right time to speak? Yesterday, who attended when we were sitting in the other room? The doctor forget to say, is it the right time to talk? And then I told, okay, let me park my car, yeah? By 7 minutes, let me park my car to receive this bad news. Because I cannot absorb it. 1 second I was driving. So please always ask. The third point here. What is the third point before you start the consultation? Is it the right time? Is it the right time to talk? By the way, if you think of it as an exam, you're not going to be able to say it properly. If you don't think of it as an exam and steps, you will say it properly. So when you start working, inshallah, in UK, you're not going to be, is it me or hair? It's me calling. I am calling here. I am calling. It's not here, so I should ask her. Is it okay to talk? Then, no. Now you will think about it until you get used to it. But wallah, if I tell you, speak. You are in the hospital, you've been asked to speak. That's what you will do. Is it okay to talk? But don't think about it. Try to train well till you just like say it. So is it the right time to talk if you are ringing? But if she's ringing, the patient, don't ask. All right, so is it the right time to talk? Step 4. Step 4 is basically starting your consultation. So from step 4 you are starting. And when you start the consultation, that's when you see, is it how can I help you station? Or is it I can see from my note station? What do you mean? How can I help you or I can see from my note? Is it how can I help you, like you are ringing me? Or is it I can see from my note that you have some concerns about your dad, which means that you are ringing? Or am I ringing? I'm here to confirm, to update you about your dad. Which one? You get me? Because if you are ringing the doctor, he's gonna say, how can I help you? But if the doctor is ringing you to update you about your dad who's admitted, he will say to you, I can see from my note that your dad is being admitted with us. I am ringing to update you about his condition. You understanding?
Yes.
Which the start is the first impression. Okay, this is the start. Here is it how can I help you, or is it how can I help you, or is it I can see from my note that your dad is being admitted with us and I'm ringing you to update you. I am ringing or I am calling to update. Do you understand what I'm saying here, guys? Okay. Which is again depending on understanding the question below. Then start your station. Step 5 is the station. Is the station. What do you mean the station? That normal station now. How can I help you, doctor? I am tired. Yeah? Explore tiredness. So after you finish the first part, that's it. It is a normal station. Do you understand? Normal. Nothing. You are over the phone now and you're speaking. So what is the most important part in a phone consultation is the first impression. What is the first impression? So what do you mean by the first impression? It is the start.
Approach.
It is the approach. It is the start. You should do it comfortably. Please, promise me, you will practice phone consultations. Because sometimes you see results and people fail 4 phone consultations. 4, because they keep practicing face to face. Yeah, you can do something. I can speak to Dr. Ahmed in the Ghalaba Mox. Yeah, the Ghalaba Mox, and we can make a phone consultation over your phones. You don't need to be face to face. So don't say, okay, we'll make a phone consultation today, okay? So we are over the phone, how can I help you? You can see here. Seriously, you're not gonna feel it. You know when you do it over the phone, you don't actually see the person. You will do it better because you don't see the person. But that's what I see here. Let's make a practice phone consultation today. Let's practice phone. So you sit face to face and your hand is like this. How can I help you? I'm fine, doctor. Okay, I can see from my note, and you don't really. So please, in a phone consultation, in the Ghalaba Mock, I will make sure I tell them to somehow arrange it in a way that you can even say in my office. If I'm not there, seriously, go and sit there. The phone consultation people. So you can put 2 stations phone consultation. Okay, this is the call center. So the 2 guys who are simulating can be there, and the 2 doctors who are, you understand, can be here over your own phones. Clear?
Yes.
Okay. Because if you do it face to face, it's not valid. And if you get used to speaking over the phone, wallah, it will be the best station. Because the first impression. Okay. Now start your station as normal. As normal mean normal station. History taking, counseling, normal. Guys, every single station in your PLAB 2 scenarios can come as phone. And the difference is
No physical.
no. The difference is at first is the start. Which would I do that in face to face? No. So the difference is the start. Whom I'm talking to, who's ringing who, where am I, is it okay to talk, you know? Confirm your full name and date of birth, first line of the address. The difference is the start. But let's talk about the thing that will make you pass or fail in phone consultation is why did they invented this kind of phone consultation? Why did they say we'll do phone consultation? Because they don't want unnecessarily cases to come to the GP. So I would not bring you to the GP if you don't need to come. Do you understand what I'm saying? Really?
Like filtering the cases.
Filtering the cases. IELTS or OET?
Yeah?
IELTS or OET?
IELTS.
IELTS, yeah. You see, when you filtering the cases, you know? So, you must have been asked like, what is the relation between filtering and IELTS, yeah? No, it's not the word, it's the way. Like filtering, you know? Like. So, in phone consultation management, I can pass you and fail you if, which I'm sure that what I'm saying now, it will be new for all of you. If a patient that you should have brought to the GP or you should have sent to the hospital and you didn't. Fail. That's fail. That's fail. Or you can get low mark. You can get what? Low mark. I did not say fail. I said fail if he should have come and he didn't. That's fail. That's not safe. That's, you know, out of order. But there is another situation when the patient, you shouldn't have brought him, but you did. That's okay. Okay, we are making the phone consultation for you to make sure that you're filtering. You shouldn't have brought him, but you did. You know, week pass. You understand me? Because you are being more safe, but we don't want you to be more safe. We want you to be safe. But the phone consultation is if he shouldn't have come, you shouldn't bring him. You understand me? And some patient, listen carefully to this point. I will say to them, hospital. Over the phone, hospital. What? What do I mean by hospital? He's ringing me. He's ringing me. And I will say, now you can go to the hospital right away. And if he can't, for any reason, disability or whatever, nobody to take him, ambulance that will take you to the hospital. You're not gonna even come to the GP. So how many situations in management I have mentioned now? 3 situations. One situation, I will bring him to the GP because who's gonna call you? Not A&E doctor. Who's gonna call you or who you gonna call? GP. GP call. They are the one for the phone consultation. So how many situations I have? 3. One of them you will say to him to come where? GP. Another situation you will say to him or to her, hospital. And the third situation, no need to come. Which is your job to filter these 3 situations. So far, it's your job. I will tell you, don't worry, how to filter them. But
how could I know that the patient is calling?
in the question,
It says.
Like, would it say like
you have been asked to call such and such. Yes. Or such and such is calling you. Okay?
shouldn't we?
Look, if I open the questions, I'm recording it. So what I'm gonna do, I'm gonna record, because this is for the new course as well. And then the questions, then we'll write it down, we can answer it later. Sorry. Because I don't have the same problem. The course is long, you know. I wanna just like 1 hour, 2 hour finish, and then we have the question. So it is written in the question, who's calling who, where you are, where is the patient, whom you talk. It is written in the question, 100%. 100%, okay? So, yeah, so I said to you, in this case is step 6. I said to you, be careful because this is life-threatening. This is life-threatening. What do I mean by life-threatening? Station-threatening. Yeah, Lab 2 result threatening. In 6 stations, your job is to be able to what? To filter. to filter the station. Should I bring him to the GP? Should they stay at home? Should I send them to the hospital? So please, when you think of management, be careful, because think of how to filter. Brother, Egyptian accent, filter. Okay? Filter. Sorry?
That's OET.
I cannot get rid of the Egyptian
Not-
accent.
not-
But
not
this
rid
is the Egyptian accent, filter. You know, I cannot get rid of it. But I love it, you know. People think I'm cute when I filter in the hospital. You understand? Is it Mr. Robert? Yes, it's Mr. Robert, you know. So I'm not talking about the, you know, people from Mansoura, because you have different accent. You have Wafni village. Anyway, so in your management, my main concern, whom should I bring? Whom should I send to the hospital? Whom should I keep at home? And what happened, the process just for you. If the GP receive a call, yeah, of a walking center or of a patient or whatever, and he thinks it's MO, he will send the ambulance to take you to that. Then he will ring the hospital, the GP. I'm sending such and such, 55. So you are prepared for such and such is emergency. He's not gonna go there and so how can I help you? What? No, you will take history, but you have what? Background. He will hand over the patient. Clear? He will hand over the patient for you. Now, I will give you scenarios verbally, and you will be able, I will ask you, I will check about the filtering, and then we'll simulate stations. And please, you should be brave enough to come and simulate. Make mistakes. But I will simulate it in a good way, over the phone. Over the phone means you will go to the other room, and you'll be over the phone. I will put you a loudspeaker so we can all hear, you understand? And so you can think of, I'm not there, he's not in front of me. Then that's what will make you seriously do good, because you can't see me. Okay. And we will simulate exam stations. Okay? So, for example, you're having a call and you are talking to the patient is short of breath. Yeah? Short of breath, some chest pain, the patient is sweating, and when you take in history, the patient is having pain going to the left shoulder, left arm. What is the management? Ambulance right away to hospital. How many of you would really seriously say, I will bring you here, I will examine you, your chest? No, we do. Trust me. We do sometimes hear these things of, yeah, I should bring you and I'll have a look at you, examine you, and they will give you, because they don't know that it's written that they are in the GP clinic or it's outpatient or walking clinic or hospital. Okay? But what is the management here? In the hospital, that's what they will do. Because I am suspecting this, provisional. So you will do everything, but don't tell him, ideally, I should examine you. Because you're not going to examine him. Because he's over the phone. And the patient that you're not going to bring, don't tell him, ideally, I should examine you. Only the patient that you will bring, you will say,
I will examine.
we need you to come because of such and such. When you come, we'll do such and such. The patient who's going to the hospital, will you examine him? No. Immediately I can send the ambulance. They will take you to the hospital because I'm suspecting such and such. When you go there, they will examine such and such, and they will give you such. You understand?
Yes.
So that shows you know what you're talking about. The patient that you're not going to bring, will you examine anything? No. But be careful, because every single patient that you're not going to bring, you will safety net. Any patient you will not bring, you will what to watch out for. Clear, please. Safety net the patient that you're not going to bring to the hospital, to the clinic. Does it make sense? Yeah, he means you should safety net him. What to watch out for. In my hospital, by the way, it's a habit I have. I safety net everyone. everybody, safety native, watch out for this, watch out for that, watch out for that. If a patient is coming with chest pain and there's like muscular, watch out for, you know, MI. So our job now, if a patient is ringing, a female is ringing, and she's saying to you, doctor, you know, I'm having some pain when I'm passing urine, stinging when I'm passing urine, and she's well, not lethargic, no, you know, she doesn't have any fever, she's passing urine well, but some stinging sensation when she's passing urine. Should you send her to the hospital or should you bring her to the GP? Neither. You will advise her. I'll tell you what.
Increase the drink if it's
You will advise her to drink plenty of fluids. Okay? If you are suspecting after history, I mean. It's not STI, it's not, you know, you're suspecting like simple UTI. Simple what? She's medically stable, no fever, no, you know? Yeah. Simple UTI, you don't bring to the GP clinic. Are you sure? Go and read the NHS. Yes. Simple UTI. No, I said she's systemically well. She's systemic well. Just some stinging sensation, doctor. Okay? And passing urine, there is no problem, there is no issues. Okay? You can ask her to take some painkillers and drink plenty of fluid and the prevention. You know the prevention for UTI? The soap, the bath, you know, these things, and you don't need to come, but at any time you feel unwell, if it's persisting, if you develop temperature, then you can come. Simple UTI. Dr. Ahab, the same one. Phone consultation. Doctor, I have temperature, I feel unwell, I have fever, pain while passing urine, and this and that, yeah? So, GP. Clear, guys. GP. Because she's systemic unwell and you will give her antibiotics. But the first one, by the way, no antibiotics. The first one, no temperature, just like she's having some stinging sensation and that's it, nothing else. No fever, nothing. The third station or the third situation, a patient is ringing you. She has not passed urine and shivering, rigors, fever, everything. Hospital, because you wanna exclude what? Pyelonephritis. You can, guys, look, ambulance, if you send an ambulance to take someone who for any reason can't go, it's fine. You're not gonna be, you know, but the fact is the principle is hospital. Hospital. But if there is nobody to drive her and she's like this, can she drive? No. So ambulance. You get me?
Do you have anyone?
Anybody to take you to the hospital? Yes. Fine. But the problem is that my point here is what? Hospital. Hospital. She is not a kind of GP one and she's not a kind of home one. I'm trying to. Okay. What if you have a station where I'm not sure? Should I bring her to the GP or should I keep her at home? Bring her.
Bring her.
If you're not sure, bring her. If you're not sure, bring her. If a patient is ringing you, and giving you, hi, how can I help you, doctor? I'm tired, I feel tired, lethargic, not myself, and you know, it's been there for 3 months, yeah? And it's not improving, really, it's increasing, heart racing, lightheadedness. What should you do? What do you think now in general? I'm just like not giving you the station, but what do you think? For example, if you are thinking of iron deficiency anemia, for example, what to do? Hospital, home, GP. GP. For some bloods, and you give iron, and then they will come later for above the blood. You understand? So you need to come. Sorry.
According to the age.
Even doesn't matter. Even if it's cancer,
Anemia needs to be corrected.
Can you elaborate? What do you mean according to the age?
If this symptoms with an old age, it could be something sinister.
The patient is saying, I'm tired, and she's 80 years old.
For a long time, like
3 months, tired.
And heart-
Once again, guys, 3 months, she's tired. and
Heart racing.
shortness of breath, for example, and she's ringing you in the GP clinic, would you send her to the hospital?
No, do first the investigation first.
No, you'll bring her, guys. Even if you are suspect, even if over the phone you think it could be cancer, don't worry, she's not gonna die tomorrow. I mean, cancer. So what? Then when you bring her and you examine her, you will do urgent referral, but not hospital. Do you understand me? Like in the hospital, sometimes we operate in patient like femur fracture, and because the patient is going to surgery, to theater, 70 years old, we do chest X-ray and we see mass. Mass. No. Finish your surgery. Yeah, seriously. On discharge. She needs to be urgently referred to.
Oncologist.
Yeah, you're not gonna stop the operation. She's having cancer. No, it's fine. Oncologist. Because she's not gonna die tomorrow from, Nothing will happen within the 2 weeks period. So still you're gonna bring her to the GP clinic. You're not gonna say to her, well, I will urgently refer you to the oncologist. You don't do this. You cannot urgently refer her over the phone. You need to see her, then urgently refer. Do you agree? Do you understand? He's like, cancer, what if she's, should I bring her? No. Should I refer her? You don't need to see her. Because when you refer her, you need to write findings, like I found this, I found that, and then when I measured her weight, she was that, and when I examined her mass, when I this, when I that, you're not gonna refer her over the phone.
Very nice.
Another scenario. You are ringing, and the patient is ringing phone consultation, and she's tired, for example, or he's tired and snoring, and his girlfriend is not happy because he's snoring, and he's having some naps during the day, and and when he wakes up in the morning not refreshed, every station can come as phone. What would you do? Yes, God, what would you do? Would you send him to the hospital? Oh my God, his girlfriend is not struggling because... No, it's fine. It's obstructive sleep apnea. He's giving you obstructive sleep apnea. Yeah, over the phone. I said to you the most important thing in management is filtering. Okay, so would you send him to the how many options do we have?
3.
Either hospital or coming to me or home. Would you send him to the hospital? No. Would you over the phone refer him to a sleeping clinic? No, to see him, assess him. Would you bring him to you?
Yes.
Yes, I'll bring him to you, and then you tell him, what will you do, guys? Yeah, we'll examine you. Guys, you will still talk about management. We'll examine you, we'll check this because I'm suspecting this and this and this. However,
Safety net driving.
you need to say to him, yeah, brother, don't drive when you are coming. Because he's gonna come to you to the GP clinic and you are suspecting over the phone what? So be safe, doctor, and up until you come, you should not
Come on, you drive.
drive. Yeah, don't drive. He can come on his own, but not. He can take a taxi, for example. He can take the bus. He can book, bus ticket and come, but don't drive. Okay, guys, I'm trying to cause what we call it brain what? Brainstorming. You need to have someone your right-handed language. Storming, So another case, for example, a patient who's ringing you and she's losing weight. Okay? And when you take history from her, what are the causes of weight loss? A, B, C, D, E, F, She's low mood. She's low mood, grieving. Her father passed away. Okay? She can't sleep, she's not able to sleep, and she's grieving. What are the 3 options? 3. Hospital or anywhere? Would you say to her, stay home? Would you bring her? You'll bring her to, even the referral for, and then you will talk over the phone about that when you come, CBT, you'll talk about management. But you need to see her. Guys, do you understand me? You cannot refer a patient over the phone. I cannot refer you just because you are giving me complaint over the phone, and then I will refer you. Okay, no, I have to see you, because referral is, there is like note you will write for. Like for me, if I'm in D&E, for example, if I'm the orthopedic doctor and D&E contacted me, and can they just refer to me without seeing the patient? No. But you will safety net about suicide, and you will talk about support as well until she comes. Support system and suicide, and clear?
The call on hold?
What do you mean the call on hold until you come? No, she's not killing herself. She's grieving. She's grieving. Yeah? She's what? Grieving. The call on hold بقى وايه؟ I would love myself to be the on-call doctor. Okay? I would love it. And I have this case at 8 in the morning. She's saying should we put the call on, and I leave it back. Everybody they say to me, what are you doing? On hold until the patient comes. You understand? I'm making sure the patient is okay. And then the patient, she arrives by 5 o'clock. And then you have one patient today because I was on hold with the patient. So be careful, guys, yeah? You understand? Be careful, because I would love it. I'm working on my shift on hold. You understand? I'll put her on hold and I'll wait for her. So be careful. On hold is not.
I'll not ask it again.
No, ask. You're asking questions about it. So grieving. A patient who's grieving. Why should I put her on hold? Is it a normal process of being upset to grieve? Yes. Why should I put you on hold until you come to me? I'm not gonna even say to come now. No. You need to come. We need to speak to you. We can refer you. We can, support system at home. Who's at home? Who's this? Who's that? We can offer you talking therapy. You can, what do you do for living? Can you manage going to your work, to your job? We can give you sick note as well, but we need to see you. Okay? Sorry?
To see her in the GP.
Because we need to refer her to psychiatrist for CBT, and
Even if it's low, mild, just low mood.
I said
breathing.
it's affecting your sleep. Guys, there are rules in psychiatry. If you have a condition that's affecting your sleep, causing insomnia, appetite, you don't eat, you bring, yeah? These are indication for when to bring a patient who are depressed. When to bring a patient who are depressed. If you have low mood, that's affecting your life activity. That's what I said, She can't go to work, and she's low mood, and appetite, and grieving, and she can't sleep. Yeah, bring. Yeah. That's not mild. That's quite, another example, or I think enough examples, yeah? So let's practice.
Okay.
And phone to consultation. Someone will go there, and they will have anybody's phone from here, okay? So we can use the phone, and then we can see the consultation, okay? And I would love it, guys. Be brave. Go make mistakes. Fine. It's fine. You understand? But trust me, any mistake you will make now, you're not gonna make again. Okay? So I will choose who's having exam Tuesday to Friday next week. Tuesday to Friday next week. Raj, okay. Can I have somebody's phone so he can ring us on that phone, and we can put the phone loudspeaker? Thank you.
Do you have any UK number?
Yeah.
Okay, so
Okay.
give me the UK
Do you wanna go? 1 second. Let's check his mental capacity. Do you wanna go, Dr. Raj? Go and call us, yalla. Go to the other room and call us. Wait. A number. Give him look. Hold. Number, yeah, brother. Give him the phone. The doctor will give you the phone. Imagine. 07. Yeah? And we're recording. Yes.
All the people we're hearing.
Oh, sorry? You gonna call here, yeah? Okay, great. Oh, great. I did not understand what he said. Do you wanna bring this phone so they can? You are the DJ, yeah?
Yes.
So I can give you this video after we finish. Okay. Guys, write down the question, and I want all of you, if you can come a bit close and. Hello, who's that? Who's that? Okay, I want to put him on speaker. 1 second, Dr. Mustafa. 1 second, brother.
عامل الكاميرا اللي في النص بس.
Okay, guys, write down the question. Write down the question. This is the most, one of the, not one of, it is the most important question in Plab 2. Seriously. And I'm sure you see this question 5 times a week. 5 times a week, okay? You are an FY2 doctor in the hospital, in the acute medicine department, or in the neurosurgery department, whatever. You have been asked, you have been what? Asked to ring, to contact, to phone Mrs. Ali. No, no, Mrs. Ali. You have been asked to contact Julia Robert. She is the daughter of Mr. Ali. She is the daughter of Mr. Ali. I will tell you now why I choose this. She's the daughter of Mr. Ali. Are you listening to us?
Yeah, I'm listening.
Perfect. Okay? Last night, her dad complained of severe headache. Online doctors, can you hear? Complained of severe headache. And he was taken to the hospital. CT scan was done, showed massive bleeding in the brain. Mr. Ali is unconscious, but breathing on his own. Your consultant has decided that, or the MDT, multidisciplinary team, decided that he will be under palliative care, as no intervention will be beneficial for him. Talk to his daughter, Julia Robert, and address her concerns. Exactly, that's how you want it, as it is now. This is the most important question in Plab. Dr. Raj.
Yes.
I am your daughter, the daughter, your brother.
Yes. Can you repeat the? Please repeat the scenario again.
Okay. You are an FY2 doctor. You have been asked to speak to Julia Robert, the daughter of Mr. Ali. Clear? Mr. Ali had headache last night. The ambulance took him to the hospital, and they found massive bleeding on the brain. CT scan was done, showed massive bleeding on the brain. Okay? The consultant decided on palliative care. Palliative care. Because no intervention will be beneficial. Talk to his daughter, address her concern. When you're ready, I'm ready. Yes.
Put the timer at 2.
Don't worry, we will look after the timer. Don't worry.
Fine. Hello.
Hello.
Yes, I am Dr. Niraj, one of the junior doctors here in neurosurgical department.
All right.
Can you confirm your name and age?
My name is Julia Robert. I'm 25 years old.
Julia Robert. Can you call you Julia?
You can call me anything, doctor. Yes, Julia.
Julia. Can you confirm your patient name and age?
My what?
Can you confirm your patient name and age?
The patient is Mr. Ali, and his age is 80 years old, and he lives in 303 Prescott Road, doctor.
So your father, Mr. Ali, 80 years old?
Yeah, my father, yes.
Yeah, pardon me, can you repeat it again?
Mr. Ali, he's 80 years old, and he lives in Liverpool.
Yeah. Julia.
Yes.
I called you in order to update the condition of your father.
Okay.
Right. I just want to know, is it the best time to talk to you?
Yeah, perfect, doctor. We can talk. Is he okay? Because we booked the holiday, like in a week. We should go like to Egypt next week. Is he alright? Will he be able to go with us on the same time, or do you think we should delay it for 2-3 days the holiday?
Is it okay to have a chat first so that I can get into the details of the thing?
All right, it's fine.
Fine. The next thing, in case the phone is disconnected, this is the best number to talk to you.
Yes.
I just want your address in case you have to come to the hospital. In case I'm sure that you are living in that address.
Yeah, I'm living in this address here, but you want my address? You have it.
Yeah. Thanks. I have the address with me on the note.
Okay.
And in case, is it possible to come, Julia, you can come to the hospital? Is it possible?
No. You can talk to me over the phone because I'm going to work in an hour, so I can't come to the hospital.
Right, Julia. What do you know about your father? Can you tell me some?
My father, he developed the headache yesterday, and he complained that it's the worst ever headache, and I rang the ambulance, and the ambulance brought him to the hospital last night, and I don't know anything else after.
Fine. Just I'm asking you few questions. I'm sorry for that because we're able to get the details I have. Is it okay with you?
Okay.
Fine. As you told me, your father has got severe headache.
Yes.
Is there any issue of loss of consciousness?
He did at the end, yeah. After like 5 minutes, he lost consciousness, yeah.
Fine. Is there any history of any fever?
Of what?
Any fever?
Fever? No.
Fine. Is there any chronic medical condition before?
Well, he's fit and well. He's totally fit and well, apart from high blood pressure and diabetes and previous stroke.
Is he taking his medications and as prescribed?
Well, my dad is like, he's getting old and he doesn't like medication. He's not compliant, but we try our best.
Right. Is he a smoker or alcoholic?
Yes, he smokes, but he's not alcoholic.
Right. Apart from this, he is taking any medication?
He's not taking any medications, no.
And he is allergic to anything?
Allergic to anything? No.
Fine. Is there any cough or constipation?
Constipation? No. Cough? No.
Fine. Fine. Thanks for the valuable information and thanks for answering my question. Julia, I'm updating you about the father. As your father came yesterday with a severe headache, and ambulance brought him here, and we did the CT scan.
Okay.
Unfortunately, I don't have a good news for you.
Tell me, doctor, should we delay the holiday?
After the history and the physical examination, we don't accept what we should get from the investigation.
Sorry, doctor, can you repeat again?
After the history and the physical examination,
Yeah?
we don't get what we are expecting.
You did not get what you are expecting after history and examination. What did you get, doctor? What do you mean?
Do you want to call anyone?
I want to call my partner.
You want to call your partner, right?
Yes.
Right. Anyone else who is at home and you can call?
No, you said to me you want to call anybody. I said I want to call my partner. At home, yeah. At home is my mother.
Right. Do you want to call your mother? Or I should tell about his father more?
No, I don't want to call my mother, no. She's at home with me. I don't need to call her.
Right.
2 minutes remaining.
And, we did the CT scan, and the CT scan showed massive bleeding in the brain.
Okay.
And after that, our panel of experts, as your father is at the moment, he is unconscious, but he is breathing on his own.
Okay.
So he is not for intervention at the moment, but he is for palliative care. Do you know what is palliative care?
He's not for intervention. What do you mean, doctor? Why don't you do surgery to take the bleeding from his brain?
As he is unconscious, as he has massive bleeding, I understand that you are concerned and you are a worried daughter. But however, our panel of experts, they say that any brain surgery at the moment will benefit the patient, and so that's why they have decided that he is for palliative care. Do you know what is palliative care?
Who are they to fucking decide? Who are they? What do you mean we fucking decided and I'm the daughter and they did not even discuss something with us before you decide? What do you mean they decided?
They are the doctors and the consultants and the panel of experts. I know that you are angry. You are concerned about your father. But
They are the doctor, I am the daughter. They are not gods, man.
yes, that's why I'm informing you. I'm telling you regarding that. Our panel of experts, which consists of neurosurgeons, which consists of brain specialists, brain surgeons, and all the other doctors who are taking care of them, they have decided that he does not need or active intervention or active surgery does not benefit the patient.
Okay?
Are you following me?
I love him. 50 seconds. Yes, I'm following you. Yes.
Regarding the palliative care,
Doctor, is he
what I'm
gonna
telling you,
is he gonna
what
die?
is more important,
Is he gonna die?
unfortunately, our best team is with your father. But to be honest, he is a terminal patient.
What do you mean terminal patient, doctor?
Unfortunately, he is not going to, because he is a terminal patient and on the terminal care. So unfortunately, he is not going to survive.
Oh my God. Should I call my brother and my sister? Should I call them? They are in Australia. Should I ring them to come? Or there is
I
no
think
need?
so at this critical moment, and your father is a critical as well as terminally, you should call your brother.
Okay. Doctor, why don't you put him in the ICU?
As I told you that he's unconscious but breathing on his own, and so that our consultants have decided that he is not going to recover. We put those patients in the ICU which are going to recover.
So your consultant is deciding everything. And it's his decision basically, yeah?
Yes.
All right.
Julia, do you have any other concern?
No, doctor. Thank you very much.
My name is Dr. Muhammad Ayaz. I'm calling from the neurosurgical department. At any time you need any help or any other concern, just free to call me. Don't hesitate, right?
All right, doctor. Thank you very much.
Thank you.
Thank you. Thank you. By the way, you did good. No, really agitated. No, it's okay. It's okay.
He will pass.
Good. You did well. Guys, he did well.
Yes.
In comparison to what I see in this station. No, he did well. Yeah? Just a few concerns. I'm sure all of you noticed. The stress and, okay? He asked me about my name and age. I'm Julia. He said to me, your name and age. Okay? No, my name only and my dad's. Okay? Name and date of birth. In history, guys, in a Breaking Bad news station, I'm not here to discuss Breaking Bad news. You know Breaking Bad news. You know them. Okay, even the online doctors in the video, they will watch this after the Breaking Bad News, this video. So Breaking Bad News station, is it confirmed station case? Yes. Do you need to ask for differentials? What is the only thing that you need to ask? Causes. Causes. This man, CT scan was done, showed massive bleeding in the brain. Why do you need to take differential? It's over. But the question that the relative will ask, why is he having this? So you need to have a reason. So you only ask for risk factor, which is medical condition, bleeding in the brain. What is the word called?
Bleeding.
Bleeding in the brain. So bleeding disorder, blood thinner. Yeah? Kidney problem, family history of sudden death, and smoking. Brother, you don't tell, is he alcoholic? Alcoholic is offensive. Not every patient who drinks is alcoholic.
Yes, alcoholic is addiction.
Does he drink alcohol? Yeah. Sudden death? You can say, guys, if you ask any patient about sudden death, always signpost. Well, I'm sorry to ask you that question. It sounds quite alarming, but it's a part of my consultation. Why? Because imagine if you go on with a problem and the doctor is asking you any sudden death in the family. It is quite tough. So I'd like to ask you some questions that may sound alarming, but please bear with me. Yeah? And ask about sudden death. Okay? Okay. So in any Breaking Bad News station, the history will consist of, guys, the station is called the Breaking Bad News. Yeah? They are not checking are you good in medicine or not. They are checking are you good in delivering bad news or not. Are you good in what? Delivering bad news or not. And the best way in delivering bad news is your face, your body language, your tone of voice. Okay? So in history, you need to ask two things: risk factor and support system. Did he ask about support system? No. He asked later after he told me the news. After you told me the bad news, you asked me about that.
Support system.
The support to come as a part of history. As a part of history. And when he asked the support system, he said, would you like me to call anyone? To call anyone if I am with you face to face.
Do you have anyone near you?
You tell the patient, would you like me to call anyone for you if I am face to face with you? You want to call someone as a form of support system next to me. But if he's over the phone and you're gonna ask him, do you want me to call?
No.
If you call anyone, no, who's with you now? Anybody with you at home now? Do you understand me? Because what is the point of calling anyone? You understand?
Yes.
Would you call anyone maybe to say you can go to your girlfriend now, she's in a tough situation? No.
Is it okay if we offer, would you like me to deliver you, would you like to come? so
He
we can-
said,
He said so.
I'm
He said so.
asking.
oh yeah, of course. Guys, you always offer the patient to come if you are breaking bad news of death, of end stage cancer. Always offer the patient to
Before anything.
before anything. Would you like to come to the hospital so we can discuss things in the hospital? Please. If you are breaking the news of death, end stage anything, sudden death, terminal ill, please offer what? To come. Offer the patient to come to the hospital. They will say no because if they said yes, the station ended. Yeah, so they will say no. Yeah, but you should offer. Okay? So sudden death, someone will die in the stage. It is very nice question, yeah? Very nice question is offering to come to the hospital. Okay. So don't say alcoholic. Ask about support. Did you all notice about support system, yeah? Yeah. Did you see how he broke the bad news? Any warning shots?
Yes.
He said.
No, guys, he later. But at first he said, you know, at first he right away, you know, CT scan, massive bleeding. And then later on, he started, you know, so please always ask about the patient ideas. Do you have any idea what's happening here? What might be
We can
happening?
ask it.
But, I don't know if you noticed or not. Did I show him any expectation that I'm expecting anything bad?
No.
Why?
Holiday.
I always said holiday. Is he gonna be 2 days late? Is he gonna be a day late? I was showing him that I'm not expecting anything bad, which in these cases you should be even more careful when you break the bad news. Do you agree with me? Because I said, yeah, we're going to for holiday. Is it gonna be 2 days late? But he did not really. I did not feel that he broke it in a, you know. Timing is good. I gave you 30 seconds because I love you. So I said just to give him 30 more seconds.
I love you too, so that's fine.
So, do you want me to call anyone? No, because you are over the phone. Yeah. Don't use the word decided, guys. It is very decided means you are not giving me any option for anything. The consultant decide. That's it. Don't. Do you know what I mean or not? The consultant thinks. The consultant IELTS recommended. You know, the recommending. You know. And don't say to the patient, as I told you, because it sounds that you're frustrated. In such as I told you before. No. Yeah, do you know what I mean? Guys, feel the phrase. Don't say to a patient, to a relative, where you are breaking the bad news, death, when she asks you something, as I told you, which means that you are quite annoyed, but as I told you. Yesterday, one of the doctors, again, as I told you. No. You understand? And always reflect. I can see you are concerned. I can see you are worried. I can see where you're coming from, you know. Next stay. By the way, there is something I want to tell you in a phone consultation, yeah? In a phone consultation, inside the cubicle, you will find the 3 papers. How many? 3. Number 1 is the question inside the cubicle. Number 1 is the question. Number 2, the patient details. The patient details. Look, I brought you an example. So, inside the cubicle, you will see a copy of the question. Yeah? And the question in the GMC will be written exactly as I wrote it. Where you are, who your patient is, other information about the patient, yeah, special note, as it is, yeah. So the first paper will be what? Question. The second paper will be patient what? Details. Name, date of birth, address. And the third paper that may be there will be a picture. A picture of a skin lesion, a picture of a wound. In these cases where they tell you that the patient emailed you a picture of his skin lesion, so to save you the time of examining. And yes, I've received the email of the picture, and then you can tell him, yeah, I can see this, you know, because it's a phone, so they can email you a picture. So you will see inside how many paper? 3.
If they
Minimum 2.
If they send you a picture, you don't take like side shape like this. No.
If they send you a picture,
Yeah, there's no need.
you can see, no, you can see the picture, yeah. It's like the examination, yeah. You understand, guys? So always be oriented. In a phone consultation, I will go in and I will confirm my identity from where? Paper is inside. If it's a skin lesion, what I will have inside? You know, picture. If it's sometimes it's just X-ray picture, you know? Be careful, please, because... Sorry? What case? No, dermatology history, guys, I said. This is breaking bad news, guys. I'm talking about dermatology station history. But when you reach examination, you will receive you'll have a picture. Are you lost? I gave you something, another example. No, I gave you I said to you in a phone consultation, either you have 2 paper or again in a phone consultation, either you have 2 or breaking bad news 2. The patient details and the question. But if the case is medicine, they can give you 3, including a picture, to tell you that you have been emailed that picture. Clear? Yes, 3 paper in the cubicle. Question and patient details and a picture if it's a medicine case. But breaking bad news, do you need picture? No. But I'm saying if it's a skin lesion, dermatology or... Okay? Why am I telling you this? Because Dr. Ahab, some people go to the cubicle and they don't even notice. There are papers inside. You know, in the sick note station, sick note inside. Okay. Anyway, who's next? We're not gonna take long. Don't worry. I delivered my message in the phone consultation. I think. You know, but we need like one or two maximum, and we'll go like 8 minutes each and go. When is your exam? 27th of October. Anybody before?
21.
21? So all of you are around the same time, 20 and okay? 22nd. Okay, I've not listened to you before. So, yeah. Do you want a ring or do you want to give him your number?
Yeah.
Guys, I'm sorry, you can tell that my energy, I'm running out of breath and my voice is going down, and in case... Huh? Seriously? No, we've been like since 2 o'clock, two branches, and this is the consultation. هو حكيم in Jordanian حكيم.
We say it.
The doctor you say حكيم. Yeah, because we have حكيم افرض مثلا يعني.
No, we usually say it like to the senior consultant.
The senior.
Okay, will there be any break in the admin section where we have to confirm the about the death?
No. Hello?
Hello.
Okay.
You took into the phone.
Yes. You are an FY2 doctor in the general practice. GP. You are talking to the mother. Yeah?
Yeah.
Her name is Salma Hayek. Okay?
Oh.
She is 30 years old. Her daughter is Layla Hayek. She is 3 years old. She is ringing about her daughter. You are in a GP clinic. Special note none. Other information none. What you must do, talk to the patient over the phone. Take focus history, address, talk to the mother. Take focus history, address her consent, medicine. أحلى سلام. حبيبي يا عسل. Mustafa, I love you. Bye bye. Okay?
Okay.
Okay, I'm ready when you're ready. Take your time, I'm ready.
Okay.
Guys, is a
Hello?
professional. Did you learn anything? Did you? Ready? Hello? 8 minutes.
Then I'm presenting one of the doctors, Hussein Samat, one of the senior doctors in this GB clinic. How can I help you today?
Well, doctor, I'm just worried about my daughter, doctor. She is very, like, not herself, doctor. I'm just worried about her. She's having temperature.
I'm sorry for her that. But please, can you tell me about your name? please?
My name is Salma Hayek, doctor.
Nice to meet you, Salma.
Nice to meet
And can you confirm your daughter's full name and age, please?
Her name is Lala Hayek, and she is 3 years old.
Okay, thanks for calling us today, Salma. So, can you tell me more about what happened to Layla?
Well, doctor, she's having temperature, doctor. Like, I found that, you know, she was not well, and then I measured her temperature, and it was 39.
And for how long is that?
It's been there for like 1 day now.
Okay, and have you done anything for that?
No, I've not given her anything apart from Calpol, medication, over-the-counter medication.
I can see. And is she improving?
Well, no, doctor, no, she's not.
Okay, and any change over the course of the fever? The fever is going up or down?
The fever is going up, doctor, and she's not really like, you know, herself.
I'm sorry for that. And have you noticed any other symptoms from the fever?
Like what?
Apart from the fever?
Like what?
Like, is she looks lethargic and tired?
Yeah, doctor, she's not herself really, doctor.
Mhm. And is she like coughing?
No coughing, doctor. She's not coughing.
She vomiting?
No, doctor, she did actually vomit.
Okay. Did you notice any problem when she like moving any like pain, or she cry when you move her neck?
I don't really know, doctor, but she did
Okay.
vomit.
But sorry, what?
Only vomiting with fever.
Okay. And she have you noticed any rash over her body?
Vomiting. She vomited.
Yes. So, Mr. Sama, I will come to this into a minute. Have you noticed any rash over her body, sir?
Yeah, I've noticed, doctor, some rash over her body. Yes, over her trunk.
Over her tongue. Okay.
Trunk.
Can you
In her
describe it
body.
for me?
Sorry?
Can you describe it for me?
The rash, doctor, is like, around her belly and, her chest,
Around her chest and belly.
Yes.
And can you you know the size of it? Shape?
It's like irregular shape, doctor. I don't know. The size is quite big.
And regarding the vomiting, can you tell me more about it? How
She's
many
been
times?
vomiting for one day, doctor. She vomited about like 5 times.
And is there any blood in it?
No.
Is it related to her feeding?
No. I don't know.
Okay. Is she feeding right or right?
No.
Okay. And is there? Did you notice any change in her like nabi, wetting her nabi, or?
Yeah,
have
but
you
not
Yes.
as often.
Yes. Okay. And is she up to date with her vaccination?
Well, she is, doctor, yes.
And okay. And so Mrs. Selma, I need you to bring Hala to the hospital to this GP clinic,
Okay.
so we can do further assessment for her. Do you think you can do that?
Okay. I will bring her to the GPS. Okay.
Okay. So I will book you an appointment here, so we can like examining her. So we can examine her, and we can see what's wrong with her. But now we are suspecting like something a little bit serious because of the temperature and the feeding not all right, and decrease urine output, the urine, decrease in the urine. So we are suspecting something serious infection.
Okay. I'll bring her to the GP clinic. Okay.
Okay. Do you have any concern? Any question for me now?
No.
Okay. Thank you very much.
Thank you very much. Thank you.
3 minutes ago.
بقى سلمى بقى من الجاكيت بقى. In the waiting room. Salma, Huh? Yes. You see, that's why we always like hospital. Huh? Do you agree with me or not?
Yes, of course.
Like vomiting, guys vomiting, not wetting her nappy, yeah?
Yes.
Not herself, she is dehydrated, okay? And how many times vomiting? 5, 6 times. I told them 5 times, okay? And fever and rash. I mean, what would you do in the GP? Nothing.
You would refer her to.
But good job. Good. No, good that he make this mistake. Good. You understand? Because many people, many doctors, they get scenarios where the relative is the mother is telling you she's short of breath, she's not breathing, yeah, she is like, and then dehydration, and then you say bring her and you will do this. I'm sure that most of us before the session would have bring her and that will do this. No, guys, no. Hospital. I hope that if you change the bit of your thinking about phone, you're not gonna do anything in a GP clinic. And don't worry, the station, it will be clear. What do I mean by clear? clear hospital. Clear hospital. They're not gonna try to trick you. Either clear hospital or clear home. As I give him, I would not make it more obvious. It's very obvious. Vomiting 5 times, rash, fever, not wetting the nappy. You know, like she's not well. Okay. Last station. Good job. We learned something now. Last station. Last phone consultation.
Volunteer.
When is your exam? 28th? 20th? It's like auction. 20th, 28th, you know? Okay, I cannot upset you because you are from Jordan. I love Jordanian people. So I cannot say no to you. And I cannot upset you because you are Kenyan. I love Kenyan people. Okay? So you and them will do 2 stations. I will do one now. If anyone wants to go, because I said, oh, it's the last station, I will do with you one more. You understand? And it's all different ideas, guys. I'm gonna, you know. So we've done breaking bad news. We've done an emergency kind of. Okay? Hospital. Let's make a new scenario. You can go there, and then you next. Yeah. You can go.
My number.
Ring. Yeah.
07
Guys, these all exam scenarios. Yeah.
859 48 5350.
No. 5350. You see my feedback on the last station? Just to hospital. Say hospital pass.
What was his mistake?
Go to hospital. The station is hospital. That's it.
That's the only thing.
Say nothing. Hospital.
Other than that, I think he did well.
Yeah.
He did so well, yes.
Look, he's like.
Following the structure.
Yes, he was following good. Okay, time please.
Okay. Let's start.
Okay, let's start.
Are you okay?
I am good.
Okay. It's like he was running. Guys, can you mute 1 second? Mute, just to mute. Mute. Guys, in this station, I will give you the shock of your life.
Okay, that's good.
This scenario, I had some people in the exam and they got very high score. Wallahi, 135, 140, you know. And I had that day about 8. They passed, very high score. But one thing they all agreed on that day, they all failed this station. And they all failed 111, 110, 000, you know. So let's give him the station and see why. It was an idea. I will tell you the idea so you know, okay? Let's start. Write down the question. Write down the question. You are an FY2 doctor in the general medicine department, in the hospital. Anthony Welsh, 75 years old.
Anthony what, doctor?
Anthony Welsh.
Welsh.
75 years old.
75 years old.
Yes, that's his age, that's his name. Lives in Liverpool, to make it job easy, address so he doesn't remember. Lives in Liverpool. But in the cubicle, you're gonna have, don't forget paper. And make sure you hold it while you're confirming identity. Okay, the patient was admitted in the hospital with chest infection. He was admitted in the hospital for what? Chest infection. He was treated with antibiotics. And in the hospital, he developed diarrhea. Diarrhea. Okay. Diagnosis of Clostridium difficile was made. Patient is now moved to another ward. He's isolated. The patient now is receiving different antibiotic. They stopped the antibiotic and he's receiving, you know the management, yeah? We stop that and we change it. What you must do, his brother is ringing you over the phone to have an update about his brother. So the brother is ringing. Talk to him, address his concerns.
Okay.
Okay? I am the brother. I am محمد ولش.
محمد ولش.
ما أنت ولش علي ولش أحمد ولش كله ولش. محمد ولش.
Okay.
All right?
All right.
Just while he's thinking about the question, while I was recording the new course, I started the first 7 videos or 8 videos. I don't want interruptions. I started by myself. It was boring videos. Seriously. No smiling, putting the camera at home or in the academy by myself, talking to myself, you understand? And then I realized, I said, is either no interruption at all, or there is interruption, like, you know? So I started making the videos as 2 hours, 1 hour, an hour and a half, but you can't have you can't not, you know, you don't smile, you don't talk, you don't do anything. So rather than making the video 6 hours, we can make it 2. You understand? With minimum. Because you cannot just like have a video to yourself. You understand? You're not gonna smile, you're not gonna. Ready, ya brother?
Ready.
Let's start.
Okay.
Muhammad Welsh, okay?
Yes. Hello.
Hello, doctor. Hello, doctor is my brother, okay?
Hello, I'm Dr. Hassan, one of the junior doctors here.
Hello, Dr. Hassan is my brother, okay, Dr. Hassan?
Can I know who is speaking to me?
You are talking to Muhammad Welsh. I'm the brother of Anthony Welsh. He's admitted in the hospital. He's 75 years old and he lives in Liverpool, and he's admitted in the hospital for 10 days. And basically, I found out that he's isolated in a room by himself, and people going in and out having aprons and gloves. What's happening, doctor?
Yes, I can see that you're concerned about your brother. As you told me, as you said, your brother was having some.
Is it the hospital? Is the hospital not clean?
Is it what?
Is the hospital not clean?
No, it's not about it. The hospital not clean. Is it okay to have a chat to address your concern in a better way?
Yes. Let's have a
Your
chat.
brother was having, as he told me, some diarrhea.
All right.
So we treated him with an antibiotic.
All right.
This antibiotic caused some side effect, or not side effect. It's something that happens with certain people. They don't respond well to this kind of antibiotic, so they just develop something called Clostridium difficile.
All right.
Am I making sense?
You are making very much sense.
Yeah. So we made a.
Yeah.
I'm
listening.
We diagnosed him with Clostridium difficile. It's kind of condition that developed from certain types of antibiotics.
Yes.
And we changed the antibiotics for him.
Yes.
And we placed him in another room, which is called an isolation room.
Yes.
That's why you're seeing people. Am I making sense so far?
You are making very much sense.
Okay. That's why he's in isolation now, for his safety and for the other patient's safety as well.
All right.
Do you have any other concerns?
Well, what antibiotic is he on, doctor? Is he on medication through his veins?
I'm sorry.
Is he receiving antibiotics now?
Yes, another kind of antibiotics, not the same one that caused the diarrhea.
All right. Okay.
Okay. Could I have a chat with you about his condition?
Yes,
now?
you can have a chat. Yes.
Okay. Does he have any medical issues?
I'm not gonna tell you.
Can I know why?
Because I don't have consent to tell you. Come. Guys, confidentiality فن مش عنا confidentiality. You must ask about confidentiality. Guys, I am not his wife. I'm his brother. No, guys. I would forgive him if it's wife. I would say, like maybe, but I told him brother. Why did I give him brother or cousin? I give him someone who's, so to make sure that he's not thinking of confidentiality. You understand me? I could have given him wife, and then I say he should have asked if the consent is not written, but maybe he thought, what? But I said brother. Do you understand what I'm saying? There's a huge topic in medicine, confidentiality. This is confidentiality. Hi, bye kind of station. Plenty of doctors, they had such stations. Hi, I want to know about, sorry, no consent, bye. Hi, I want to know about, do you have a consent? No, bye.
This will not happen in the exam, right?
It did. Let's not go into what happened, but if I'm saying it, things, and we're sitting here like 9 o'clock talking about things, no,
No, that's not what I mean, but what will happen?
nothing. Confidentiality station.
We thought it's a
Guys, confidentiality. Station about confidentiality. That's it.
Okay, so you negotiate with them.
No negotiation. Station. You know the mother who wants to know about her daughter?
Exactly.
Brother wants to know about his.
That's what I mean.
Yeah, I was just want to check, you know, like 55 years old, Andrew Thompson, his cousin wants to know about him. Yeah, this is okay because only the mother for the OCB, confidentiality. This is okay. No, confidentiality. No, you understand me? I'm saying this is confidentiality.
It's the same.
Same. It's the mother and daughter who ask for confidentiality. What about brother and his brother? Confidentiality. Do you agree or anybody is thinking? By the way, if I discuss it, it's important. Not to show off, right? Because I wouldn't show off on you. Why? Like, I'm just like opening your mind.
So do we ask for consent or if?
No, just a simple question. Do you have a consent? He said yes. It's fine. Dr. Odim, he said yes and he's lying. It's not your problem. Don't worry.
Yeah.
If it's yes, it's yes.
Or next of kin maybe.
No. Do you have a consent? It doesn't. Yes.
But the question will say consent has not
But
been
if the
taken.
or if the question said consent has been taken, it's taken. If the question said the consent has been taken, it is taken. And I can verbalize and say, I can see from my note that you have to make sure that I'm telling them, guys, I read it and I know about confidentiality. Okay? So,
If we ask the brother that, like, do you have consent to know about his condition?
do you have a consent? If he said yes, it's yes. You don't need to say to him, show me or send
Shouldn't
me.
we know, like, if
Guys,
they have consent?
Sorry?
I mean, will it say you?
No.
He does not have.
It doesn't need to say. If the question I give to him, did I say anything? I don't need to say. He will ask me, do you have consent or not? Let's move on because it's not really like, there is nothing to discuss here. You understand? One second. There is nothing to discuss here. If the question said consent has been taken, if I am in the exam, I will show them that I know. I will say, I can see from my note that consent has been taken. How can I help you? If the question said consent has not been taken, it has not been taken. But they're not going to tell you the consent has not been taken for you to go and say no. Guys, if I'm giving him a question like this, I'm not going to write down, by the way, consent is not taken. No, I'm just going to leave it without mentioning. But if I don't want you to ask about consent, I will tell you. So I will mention consent is being taken, but I will not mention the question consent is not being taken. I will leave it for you to answer, to ask. Clear. It is confidentiality. It is yes or no. Surgeon, son, consult, wants to know about his mother. Okay? She has mental capacity. Do you tell him? No? She has mental capacity. You don't. This is the same guy.
Okay.
Same. But don't just fix your head that confidentiality is only with certain cases. Confidentiality is confidentiality. So if the question said consent has been taken, it has been taken. But if it's me, Muhammad, in the exam, I will even focus on it. For them to write it, I will start. I can see that consent has been taken. How can I help you? To tell them that, guys, I know about consent. And if the questions did not mention, doctor, what if the patient gets angry? Guys, don't worry. No, that's law, rules. You're not upsetting him by asking about something that you should ask about.
Yes,
So, think of confidentiality. Have it in the back of your mind whenever you are talking to a relative. This case is Clostridium difficile. Everybody knew about it, but they all failed. You understand?
Yeah. After asking for the consent, can we proceed with the rest of
If you are asking for the consent and they said, I don't have consent, guys, I'm really sorry, and then it will become a surgeon's son. No, tell me, sorry, I can't. No, tell me, sorry, I'm obliged. No, tell me, it will be that kind of stations. You know?
But We don't ask the brother for consent, right? We ask the patient for consent.
No.
Consent means if he has.
She said you ask them, can we proceed?
So doctor, can
Guys, I think the best way, look, I stay sometimes in things that deserve us to stay. But this one, confidentiality. No consent, let's move on. Seriously, it's let's go to next station.
Okay.
Confidentiality, like no consent, I'm not gonna talk.
Ibrahim.
Copy and paste from the OCD patient, copy and paste from the surgeon consultant, copy and paste from the son who said don't tell my mom, but I will tell her, you know, copy and paste, confidentiality. What if the question is not having the word? Ask. Next station, doctor?
Ibrahim.
Doctor, go quickly because we need all to go now. Everybody's okay? Nice station, the last one, yeah? Good? No, you picked what we want. That's it. But okay.
I thought it's a medical error.
Sorry?
I thought it's a medical error or something.
Somewhat?
Medical error.
No medical error.
I make a formula for talking to relative.
Sorry?
I make a formula for talking to relative. 4 C's. Confirm, consent, then concerns are very important, and fourth is how you are copying. Is copying. 4 C's.
Oh wow.
Perfect. Really perfect.
I'm just telling you if you want to add.
Yes, I will add 4 C's. Guys, whenever you are talking to a relative, you have 4 C's. 4 C's, not 4 seasons. 4 C. Okay? What? Confirm? Confirm identity? Consent? Concerns?
And then how you are coping with it.
Coping. How you are coping with it. Confirm identity. Concerns. Ask about the concerns. Consent before even. Consent. Concerns. How you are coping. 4 C's. I love this kind of. This is Dr. Raj. Yes. This is Dr. Iyaz invention. Perfect. Well done. So it's not me. It's his.
Copyrights.
Yes, it's his. Copyrights. Yeah. Okay, let's start. Give him the last station. Okay. 17 years old. 17 years old.
Is he on the line?
Can you hear me, yeah?
He hasn't called.
Is he not on the...
He hasn't called.
Can you hear me? 1 second. Can you hear me?
I can hear you. Can you hear me?
Yes, I can now, yeah. 17 years old.
Yeah.
Okay?
17 years old, yes?
Yes. Angelina Jolie.
Okay.
She is making a phone consultation because she has some concerns.
Okay.
You are an FY2 doctor in the GP clinic.
Okay.
Talk to her, address her concern.
So I'm the one calling or she's the one calling?
She is calling. She is the one calling because she has some concerns.
Hey. Hello?
If you wanna think for like 2 seconds, okay.
So it's a 17-year-old Angelina Jolie is calling, she has concern.
Yes.
All right. Yeah, I'm ready.
Okay, start.
Hello?
Hello, doctor.
Hi, this is Dr. Ibrahim. I'm one of the senior doctors in the department. Can I confirm who I'm speaking to, please?
I'm Angelina, doctor.
Angelina how old are you, Angelina?
I'm 17 years old.
Okay, Angelina. So how may I help you today?
Well, doctor, I want the emergency contraception, the morning after pill.
Okay. Do you want to tell me why you want this?
Well, because I had unprotected sex 2 days ago. Very common station, yeah? 2 days ago.
When did you have... Sorry?
I had unprotected sex 2 days ago.
Okay.
Hello?
I had unprotected sex 2 days ago.
Okay. Was this the first time that you've been having unprotected sex?
Well, no, I've been sexually active, but this is the first time to have unprotected sex.
Okay. You just told me now that you have unprotected sex 2 days ago, isn't it?
2 days ago, yes.
Yes. Before these 2 days, have you had it like a week or a couple of days ago?
What do you mean?
Did you have it, this unprotected sex that
No,
you told me?
this was the
that
first
you've had?
time. This was the first time ever to have unprotected sex.
Okay, all right. So definitely, yes, we can give you contraception, but just to ask you more specific questions, it might sound a bit intrusive, but it's just going to help me to be able to decide.
Okay, doctor.
What to give you. Would that be okay?
Definitely.
Okay. So I'm just going to ask you about your sexual life. You told me you're sexually active, isn't it?
Yeah, I am sexually active. Yes, doctor. Yes.
And do you practice safe sex?
Well, I do practice safe sex apart from 2 days ago. Yes.
Okay. And are you currently taking any pills? Any contraception?
Well, to be honest, no, because I was asking the partner to use condoms. So.
Okay. Okay. Do you remember when was your last menstrual period?
It was 2 weeks ago.
Okay. And are you suspecting that you're pregnant, or are you pregnant by any chance?
No, no.
Okay, good. So, your concerns are valid. Yes, after having unprotected sex, of course, there are high chances of you getting pregnant, and especially the fact that you've told me that your last period was 2 weeks ago.
Okay.
And just a little bit more questions.
All right.
You're 17 years old. May I know the age of your partner that you're having sex with?
The age of my partner is 20. No,
20.
25.
It's 25.
Yes.
And who is this partner? Is he your classmate? Is he your teacher?
No, classmate, because I'm 17, he's 25. And not my teacher. Okay, he is my brother's best friend. He's my brother's best friend. My brother's best friend.
He's your brother's best friend?
Yes.
And does your brother know that you guys are together by any chance?
Yes.
Hello?
Yes, he knows. Yes, he knows.
He's aware.
Yeah, he's the one. He's aware. Yes. He's the one who introduced him to me.
Okay. All right. I'm just going to ask just a few more questions, yeah?
Yes.
The fact that you're 17 years old.
Yes.
And you are sexually active.
Yes.
There is nothing wrong with it. It's just that I'm really concerned about the age of the person they're actually having sex with.
Okay.
And as a professional, it's my responsibility to also protect you. Yes.
Okay.
So the person you're currently having sex with is above your age.
Yeah.
And for the purpose of protecting you, I'm sorry, I will have to inform social services.
So you will inform social services. Okay.
Yes. But because you told me that you've had unprotected sex a few days ago.
Yeah.
I'm going to prescribe you an emergency contraceptive pill.
All right.
Just to ask you, are you currently taking any medication?
No.
Have you been diagnosed with any non-medical condition?
No.
Do you have any allergies?
Why don't you save your time? Have you taken the pill before? I've taken the pill before 3 months ago. 3 months back. And that was fine.
You took the pill?
No allergy? Yeah, no allergy. I just want to ask this question as logic. No allergy, nothing.
Sorry?
No medical condition. Nothing. No allergy, no medical condition.
Okay, and have you taken any pill before?
No. Have you?
You haven't?
Okay, yeah, no.
So we've got a couple of options that I could help you with.
Okay.
One of the options, I can give you a pill that you're supposed to take within 3 days after having sexual intercourse.
Okay.
Yeah?
Yes.
And we also have another one that you can take within 5 days.
Okay.
Yeah?
Yeah.
And you can use this pill. But however, just a few more things that you need to be sensitive about. Have you discussed anything? Have you talked to anyone about your relationship, like your parents or anybody?
I know my brother. I told you my brother, he knows. He introduced him to me. He knows my brother. On my birthday, he brought him to my birthday, 17 years old birthday, and it was my birthday gift. This beautiful boyfriend.
Okay. All right, I understand. Just as your doctor, I would advise you that it's against the law.
Against the law.
Somebody who is above your age to be sexually active with.
Okay.
He's above. He's way older than you in terms of, if you were somebody probably in the same age that we will not take this seriously.
But he's treating me good. He's nice. He's beautiful. He's soft. He's treating me nice.
I know. I understand. But it's just that for the purpose of your protection, you're still under 18, and we still have to protect you until you get to this.
But he protects me.
Age.
He protects me.
I know. I understand that he does protect you. Okay, but I feel that as a professional that it's a form of abuse.
Abuse. Okay.
Yes.
All right.
Did he force you? Did you want to have this sex yourself?
No. I want him. He wants me. I love him. He loves me. No. We love each other.
Yeah. I understand, but I'm sorry just to tell you that it's the age difference is a concern.
All right. Thank you very much. Thank you. You can come.
Thank you.
Thank you. You know, one thing I noticed, the more I just want to stay with you, I know you are very tired, but the more I stay, the more I feel happy, because I can give a message that may be, okay, how many of you thought or is thinking of informing social services? From your heart, seriously, I don't want you to say, oh, me, but you are shy. How many of you, raise your hand, you will inform social services? 1, 2, it's fine, guys, we are here to learn. Okay. But if you're not going to inform social services, what is the question that you need to ask?
Mental capacity. Mental capacity.
The job. So let's make it easy, okay? And doctors who know, good that you know, but just a quick thing, and I will tell you unexpected question, okay? Guys, end of story. How can I help you? I need the emergency pill. How did you know? Why do you want it? Sexual history, everybody knows. Yeah? And when you give her the pill, anyway, is there any circumstances where you don't give her the pill? No. In all circumstances, you will give her the pill. So, the best answer in these stations, when you have a female coming and she wants emergency contraception, definitely we can help you with that. Of course, we can give you that. That should be the first phrase. Because even if she's getting abused in terms of, even if the partner is elder than her, would that prevent you from giving it to her? I'm about to finish.
I had my test 2 days ago, and it was very helpful, really. Like, I can't highlight enough.
We had our test. I had my test 3 days ago. He had it a week ago.
A week and 3 days. Yeah.
A few days ago.
Yeah. He's like a week ago, and I was like 3 days ago.
3 days ago.
Yeah, it feels like 3 days.
Time is like rushing.
Wanna meet, guys? Wanna go? You know, I've seen you sitting there. I know you've had the exam.
I'm going back Egypt on Tuesday.
Text me because I want you.
Yeah. Would you like to send any?
Text me. Yeah.
So when you want to interrupt the lecture tomorrow,
text me. Yeah,
lovely seeing you.
Habib. So, at any circumstances to agree, there will not be a circumstances where you would not offer the pill. What if she is 15 and the partner is 25? Would you offer the pill? Yes. Why? Doctor, she's getting abused. I don't care. I will inform social services, but I don't want her to get pregnant. Yes. Because it will be abuse and the abortion. Do you understand what I'm saying? Because some people think Dr. Moshe is getting abused. Because I don't know, sometimes you have different resources. Sometimes, you know, any online thing, you watch, you listen, you see, you read, and then you end up by, no. At any case, I will give the pill. No doubt. Because if I don't give her the pill, what will I benefit? Dr. Mo, because if I don't give her the pill, she will stop. She's not going to stop. You understand me? Some people think if I don't give her the pill, she's going to stop having, no, she's going to be pregnant. And then it will be abortion. So at any case, you will give the pill. Let's move from this point. And make sure you tell her you will take it right now in front of me with water. If you vomit, come back. That's one thing.
I bring her to the GP.
In a phone consultation, yes.
Yeah,
But
and then I offer a pregnancy test. No?
let's that's not my main concern. My main concern is there is a bigger problem here. The age. Bigger problem. I can offer her STI screening because it's unprotected sex. Okay, I can offer pregnancy test, it's fine, but my main concern is the age. Okay. I will make it very easy and please understand it. 13
And below.
No, and 16, guys. Guys, 13 and 16. 13 and 16. 13 to 16. So 13 or less, you will inform social services. Guys, 13 or less. 13 or 13 or inform social services. Inform social services, or we call it safeguarding, social services. So 13 or less inform. No, she's over 13. 14, 15, 16.
The same age.
No. She is over 13 till 16. So 14, 15, 16. Guys, as long as they are the same age group, as long as they are the same age group, do nothing. Do nothing. Do nothing. What do you mean do not? Don't inform any. I'm talking about informing social services only. I will give her the pill. Okay? Don't inform social services? No. As long as they are same age. 14, 14. 14, 15. 15, 15. Don't inform anybody. عيال مع بعض. Kids together. Similar age, it's fine. So 13 or less, 100%. 13 years old or less, 100% inform. Over 13 to 16, 14, 15, same age group. Don't inform. However, if one of these groups, 13 to 16, with one elder than 16, now it's two different age. So she's 14, he is 18. She is 14, he is 19. Is it the same age group? No. You inform.
Social service.
You inform. You inform social services. What if above 16? What do you mean, Dr. Mo, above 16? She's 17 and he's 25. It's fine. So above 16 is okay. Above 16 is?
Is it 16 and above?
Guys, above 16 is okay. 17, 22, 17, 25. They will not bring in the exam grade. They will bring as I brought. Guys, in the exam, they're gonna bring something clear. But I'm giving you, rather than giving you a script, I'm giving you the whole thing. And they can bring in the exam whatever. So, 17 and 22. Anna, 17 and 22. 17, 25. Okay? You understand? Seriously. So, it's fine. But, between 13 and 16, like she's 14 or 15, and he's over, another group, over the 16. Like he's 20 and she's 14. Do you inform? Guys, come on. Our group is up to 16. Our group is up to 16. If they are 13 to 16, same age group, okay. If one from this group with one elder, yes, guys, inform.
Boy or a girl? Yes.
So if a boy is 14 and
Yes, guys, you understand? Yes, so in this age group, if she is 14 and he is 18, 19, they inform? Yes, different. Because what is the cut level? 16. What is the cut level? 16. So, by the way, it can be 14 years old boy and the girl is 25 or 22. Is it abuse?
Yes.
Abuse, yeah. It was fine.
No matter.
So not only girls can be abused, but also we can get abused. So we can get abused. Boys can get abused as well as girls. So be careful, yeah. So
It's fine. We have
13 or less, all cases informed. Between over 13 till 16, as long as they are both in the same age group, do nothing, don't inform. If someone from this group, 13 to 16, or someone from the other group, elder, 14 and 20, do you inform? Yes. 17 and 22, both of them over 16, guys. Both of them 16 or over. She's 17, he's 25. Any problem? No, guys, they are in the same group. They are in the same, unless he is in a position of trust. What do you mean, Dr. Mo? If he is in a position of trust, the age 16 will go up to 18. That's it. What do you mean, Dr. Mo? So if he's in a position of trust, he's her GP, he's her teacher, he's her counselor, he's her coach. Then it's not 16 anymore. The cutoff is 18. What do you mean, Dr. Mo? So the cutoff will be 18. So she should be 18 or over to be okay with him. As long as, or the only condition is if he's in a position of trust. No position of trust like this. He's my brother's best friend. It's fine. Position of trust, GP, counselor. At this time, the cutoff not 16. The cutoff is 18. So whenever you have a patient, someone who's over 16, like 17, for example, 17, then it's okay unless there is no position of trust. So ask about the job. How do you know him? He's my brother, best friend. It's fine. Do you understand?
Yes. Yeah.
But what if she is 19 and he is 25 and he is his GP?
It's okay.
Guys, it's fine. You understand? It's fine means that yes, they should not meet through the, he should not like get her details of the system, but they're not gonna bring such position of trust. If they're gonna bring it, they're gonna bring 17 and 25 GP. Then you inform or not? Yes. But if she's over 18, no. So the cutoff is 16. Unless he's in a position of trust, it goes up to
18.
Are you confused?
I mean, it's okay.
No, it's not okay.
Is it?
It's not okay. 13 to 16?
Yeah.
16 is the cutoff. Over 16 is okay. Unless position of trust, the age will go up to 18. And by the way, think about it. This position of trust thing only if she's 17. Because if she's 19, it's fine. Even in the position of trust. Do you agree?
Exactly.
Only in this age.
So the only doubt is that 18 is a cutoff, but 18 and above is okay.
It's okay.
18 is also
Oh yes.
18 is
Yes, yes.
Even if it's not okay.
Yes. We're not gonna inform social services.
Age is 13 girl and 15 boy.
14 girl, 15 boy, okay. They are in the same frame.
Okay.
This is the frame, 13, 16. Guys, so when I talk about position of trust, only if she's 17. Why? Because if she's 18 or more, it's fine. That's it, it's fine. Anybody has any doubt?
No.
So what is the cutoff age for having sex? 16 or more. Unless the partner is position of trust, so it will go up to 18. So if she's 17, you need to ask about the age of the job. What does he do? Or how did you meet him? To know about position of trust. One more thing. No. Yes, and we said boy can get abused.
Yes.
Okay? So what if she is 18? She's what?
18.
18. And there is a trick here, yeah?
Okay.
There is a trick coming now.
Yes.
The last exception. What if she's 18 or 19 and he's 45?
Oh.
Okay.
So we just call him lucky man. That's it. He's lucky. Guys, thank you very much. Guys, thank you very much, yeah? Thank you. Thank you.